What happens in a hair transplant, these permanent hairs from the back and the side of the head are actually removed and processed into the individual follicles, which can have 1 to 3 hairs, while the staff are cutting up these grafts. Sara and I are pre-making all the holes. And this is really important. It's a bit like bricks and mortar. It's how you place them in relationship to each other, how close they are, what angles they've got, what direction they've got, that actually affect the total outcome of the procedure.
So let's just recap. You take out the donor site, the team is splicing up the follicles.
Correct.
And as that happens, you and/or Sara are making holes.
Correct.
To insert these follicles into.
So we've pre-made all the holes. We want to know, we've worked out what sort of density, how close we want them together, what sort of angle we want them on, and the direction in which they're flowing.
And the angle and the direction relates to things like the curl and the movement of the hair that we discussed earlier.
Exactly.
Great, I'm getting clear.
It has to be individualized, okay? You can't, it's not like going to Target.
Right.
And one size fits all. This has to be individualized. You have to have a well-trained team. The reason being is these follicles, once you take them away from their blood supply and they're living in some chilled saline, they're actually going to start dying. So you have to have a well-trained team, especially when you're doing the large procedures, because you must get those follicles back into their nutrition and oxygen in their new position on your head within 6, maximum 8 hours.
You're making all the critical decisions. You're overseeing this while the team is actually doing the doing, if you like.
And the doctors are doing the doing as well, but you've got 120 man hours to do one procedure, so we need to share the load. We're in control the whole time of safety and of the overall quality of the result that you're going to get.
Okay.
So nothing's left to chance.
As far as pain goes, pain during the procedure, you won't know anything about it. I promise you, you won't know anything. And if you started to feel any little twinge, first of all, before you get full-on pain, you get a slight burning. You report that to me, I'll make sure there's no more.
Okay, so twilight sedation means that I'll be conscious enough to talk to you if something is concerning me.
Yes, so
but I'm relaxed enough to sleep if all is well.
If you have no adverse stimulation, you will sleep. But you waken up if you want to go to the bathroom, or you're thirsty, or I cause you some discomfort, you're waking up, tell me what the problem is, we take care of that, and you go back to sleep. Isn't that right, Sara?
Exactly. It's like having 4 tequila slammers.
All right, I'm in. What's next?
So that's essentially it.